Here's today's MercyOne Gensis Medical Moments.
We are continuing our conversation about lung cancer with Dr. Humphry Wong from MercyOne Pulmonary. So, Dr. Wong, we've heard about the ion robot being used for lung biopsies. Talk to us about this new technology and how it changes the way you diagnose lung cancer.
Thank you for that question, Brandy. I tell you, this is just revolutionary for us, in my opinion. In the old days, we would have a bronchoscope, but we really could never go past very far in the lungs because the scope is too big. And so with this technology, it allows us to basically travel from the beginning of the lungs all the way to the edge of the lungs. And that's how small this scope is. And what they've done is they've basically married the CAT scan. They've converted the data on a CAT scan into like a Google Maps. And so it maps out the airways of your lungs, just like the city streets of Davenport. And it tells us exactly where to turn, where to go, and it reaches the lesion. And when you hit there, there's a dot that says you're here. So it is just revolutionary for us to improve our accuracy in reaching these small lesions so we can biopsy them. In addition, there's also new technology where you can have almost like a CAT scan that tells us if you're right there or not. So we can do a CAT scan while doing the procedure. And so that dramatically improves our accuracy in diagnosis.
Yeah, we've come a long way. We've come a long way with technology,
it's been revolutionary.
To traditional biopsy treatment, right?
Absolutely.
Yeah.
Absolutely.
Okay, so how, who is an ideal candidate, to use this?
Well, in my mind, I think most patients are a candidate. Of course, we'll have some patients that have severe lung disease or severe heart disease, which may be too weak. They may be too weak to undergo the procedure, but for the vast majority of people, they're candidates. We'd like to have, if we have a patient that needs this procedure, we're looking for lesions that are about 1 centimeter to 1.5 centimeters. And the beauty of this machine is that it can reach all lobes of the lung, and it can go pretty much anywhere it needs to go. Traditionally, with a needle biopsy that we would do under a CAT scan, it's only limited to the outside part of the lungs. So it gives us a bigger reach, and also gives us more options.
So let's talk about the treatment plan. How does this technology, impact your ability to create a treatment plan more quickly or maybe more efficiently?
Well, right now we have a new age of cancer treatments where it's based on the cancer or the person's genetics. So it allows us to take more biopsies so that can be studied for possible treatment. It allows us to biopsy more than one nodule at a time. And it also allows us to stage the patient potentially as well. So in other words, staging means, is it elsewhere in the lymph nodes? So if we get that all done in one setting, it speeds up the workup, and it basically allows us to refer the patient to an oncologist much faster.
Okay. So lung cancer, it often carries this stigma associated with, those who smoke. They think, oh, if you're a smoker, then you're going to develop lung cancer, right?
Right, that is so right.
What do you want people to understand about lung cancer risk and screening?
Well, a couple important things. Certainly, tobacco smoke is a risk factor for lung cancer. We also recognize that secondhand smoke, radon in the homes, and certain occupations carry an increased risk of cancer. But regardless of that, if you meet the criteria for screening, we know that if you enter a lung cancer screening program, if you're at risk for lung cancer, your risk of mortality drops by 20% over a 10-year period of time. So those are very important facts to know. Also, the screening is easy. It's a CAT scan, it's low dose, and it probably only takes 15 minutes or less to do. No needles, no IVs. So really, it should be pretty easy.
Good to know, definitely. Like I said before, we've come a long way. Where should people go to get more information?
Well, please talk to your doctor about lung cancer screening. Everyone knows about it. Or you can always visit our website at MercyOne.org, and you'll find the URL that takes us to the lung cancer tab.
Wonderful. Well, thank you so much for your time today, Dr. Wong.
Well, thank you for asking me.
All right, this was your MercyOne Gensis Medical Moments, and for more information, go to ourquadcities.com and click on the medical tab.